This video is about the use of endosequence RRM Putty fast set for adult pulpotomies. This tooth number 3 was referred to my office for endodontic therapy. However, during the axis opening, a large mesiodistal fracture line was noticed, and the tooth was deemed to be unsalvageable, considering the patient's desire to have a more predictable outcome. As a result, since extraction was recommended, we decided to see how long we can keep this tooth through the use of an adult pulpotomy and keep the patient until symptoms appear before the tooth would be extracted. This shows us the mesiodistal direction of the fracture line. You can see it that the fracture was actually shown through the composite as well as the composite itself had cracked, and it was extending deep on the furcal floor. So since there was still a little bit of bleeding from the paddle canal, I decided to just very quickly use the endosequence sealer and the endosequence system to prepare and fill the paddle canal only with a gutta-percha cone and the endosequence sealer. So here I just used the size 35 endosequence finishing file, and then I use some ultrasonics, and now I'm just going to irrigate using some hypochlorite and dry the area. You can see here the buccal canals, and there is not much bleeding there, although the tooth was vital prior to starting the root canal therapy. And some sealer is placed now. This is the biceramic sealer that is being placed, BC sealer, in the paddle root, and then a file is used to push the sealer down to the full working length. And once the sealer has been pushed down to the length, then the corresponding size gutta-percha cone, which is this 35 BC cone, biceramic coated cone, is now being cemented to full working length. Once the cone has been cemented, then the handle is seared off at the level of the orifice using a high output heat source, and then the remainder of the gutta-percha right at the orifice level is condensed using pluggers such as this size 10 and 9 Schilder pluggers. It's important to condense the gutta-percha right at the cavus surface margins where it meets the dentin, and then the excess sealer, biceramic sealer on the floor, can be cleaned out using just water, and then it could be rinsed out. So now the question is filling the remainder part of the chamber and over the exposed pulpal stumps on the buccal canals. And here is the syringeable fast set root repair material putty that you can basically just inject out of this proprietary syringe and pick it up with a sterile Woodson, the back of a Woodson or another spatula, and you can very easily, like a little plug, place directly into the axis opening. This is the easiest way to manipulate any kind of bioceramic, and this is really a great innovation to come up with this particular formulation of a bioceramic that can so easily be applied to the site. And here, once it's been placed, the bulk of the material has been placed, you can also use some pluggers, again this size 10 Schilder plugger, to just kind of tuck in the margin, the cavus surface margin of the material as it comes in contact with the dentin, so that you can have a clean dentinal wall, because the next step is, after you have given yourself a good 2 to 3 millimeter thickness of this putty material on the pulpal floor, would be to fill the remainder of the chamber using a glass ionomer. In this case, I'm going to use a Fuji 9, which is a reinforced core glass ionomer, and it would bond very nicely with the on-set material. Now, this fast set biceramic putty will set also in about 20 minutes, but because 20 minutes is fairly long for it to set, I would like to fill the remainder of the canal immediately using the putty. So I do that very quickly after the placement of the fast set material, biceramic material, and then as you can see, I'm just backfilling, making sure that I'm not trapping any voids, and fill it up all the way to the surface. Then I'm using a wet cotton pellet to just remove the excess and make sure that I don't have any high occlusal areas. And after I remove the excess cement, excess glass ionomer cement, then I just dry the area around, and it's important then to add a layer of varnish, because as we all know, glass ionomers are a little bit sensitive to moisture before setting, so it's important to just put a layer of varnish. I'm just using a little bit of a bond. You can use brush on bond, you can use the L bond, any of the ones that bond systems would do, or just whatever varnish you have available. And what it does is it gives the material a chance to set at the time where it's moisture resistant and not be affected by saliva. Here's the final post-op. As you can see, that there is the paddle canals filled, and there is a layer of bioceramic on the chamber floor, and the rest of the canal is filled with glass ionomer. And this is already a 1-month follow-up, shows absolutely no symptoms. I'm following up with this patient to see how things go. Obviously, because of the crack, the tooth has to eventually be removed, but my goal has been to see if this can extend the amount of time that the tooth remains in the mouth. And I think this is a good service for a patient like that. It's obviously, we didn't charge this patient, it's a quick service to just see how long we can keep it until the tooth has to be extracted. But a more important thing here is the demonstration of the use of this new fast set putty for doing pulpotomies so easily. And this could be very helpful to the pediatric dentists out there who may want to employ the use of these biceramics for pediatric pulpotomies. As you saw, the technique is very simple, and it would be far more effective than the regular calcium hydroxide, because this biceramic material bonds chemically to the dental floor, as well as it's more biocompatible than calcium hydroxide alone. This is a potential use, as well as possibly using this material for adult pulpotomies in cases where a patient cannot afford doing root canal therapy, and the only alternative would be the extraction of the tooth. So this is something to keep in mind and potentially look out for in the future as a potential ramifications of this new technology of bioceramics in helping people with saving their teeth. I'm Ali Nasseh, and I hope this tutorial was helpful.